the week 8 of your obstetrics. Let me share my screen. So we will be talking about the EINC, the Essential Intrapartum Newborn Care. And guys, the EINC is lifted from the WHO protocol. It is what we call a product of evidence-based practice that should be implemented, okay, in the clinical area. So the EINC, as observed in with regards to your flag, your 9th edition, your maternal and child health nursing, is different. Okay, so for now we will be having EINC as a part of the evidence-based practice, and then later on, okay, for the week 9 and 10, we will be having the discussion of labor and delivery by the flag. Okay, so pagbabanggain natin sila guys for the purposes of taking down the most important topics in the board exams. We have here the essential intrapartum newborn care. We will start with the immediate care of the newborn. Okay, so for the assessment of the newborn and the well-being of the newborn, we are using the Apgar scoring. Actually, the Apgar scoring is not a responsibility of the midwife or the nurse, but we should be at least having an idea of what it means by doing the Apgar score, or how will we do the Apgar scoring. So this is used to assess the newborn's well-being through observation, rating of its respiratory effort, muscle tone, reflex irritability, and color. And this is done just after the delivery of the newborn. Okay. Next is if here, let me just navigate. Okay. Okay, so the Apgar scoring is done in the board exam. Please note of this on the first minute of life of the newborn, and then on the first 5 minutes of life. For the first 5 minutes of life, or the first minute of life, it is done to immediately assess, okay, the well-being of the newborn, or how uh, what is the immediate assessment that you could have when you look at the newborn upon baby out. Or for example, you would note of the first cry of the newborn, you would note of the color of the newborn, and the reflex irritability. In the first cry of the newborn, take note of this, okay, my dear midwives and nurses. Okay, that the first cry of the newborn is the first time that the newborn uses his lungs for breathing. Okay, so inside the womb of the mother, tandaan ninyo that the newborn is breathing through the placenta. Okay, so the placenta is the multi-organ of the baby. So when you cut the cord, okay, during delivery, and you hear the first cry of the newborn, so that was the first time that the newborn used his lungs for breathing. Okay, so we have here the first 5 minutes of life. It is used or done to assess how well the newborn is adapting to the extrauterine life. When we say the extrauterine life, it is the life of the newborn outside the womb of the mother. And mom, why do we need to assess the adaptation of the newborn into the extrauterine life? Because um, inside the womb of the mother, the newborn is having a conducive environment because of the thermogenic effect of progesterone. And when the baby is out, okay, the baby needs to adjust to a world without progesterone. Okay, so this is our Apgar scoring. If you'll try to note here, okay, you'll have the heart rate. So if the heart rate is absent, it will be scored as 0. If the RR is absent, it will be scored as 0. If the muscle tone is flaccid, it will be scored as 0. For the reflex irritability, if there is no response when you put or place the catheter in the nostril of the patient, or when you're just trying to just place it for maybe for suctioning, okay, and there's no response, and that is scored 0. And we have the actually you slap of the sole of the foot. Sometimes you don't slap the foot of the baby, but we just pinch it or do the magnet reflex. Okay, so that is if there is no reaction, so that the baby is scored 0. And when the color of the baby is blue or pale, it is scored 0 for 1. Okay, if the HR is less than 100 BPM, it's 1. For more than 100 BPM, it's 2. And for RR, if it's low, irregular, or weak cry, it's 1. And sometimes indicative of TTN or transient tachypnea of the newborn. And then we have good cry or strong cry, it's 2. Again, the first cry of the baby is the first time that the baby used his lungs for breathing. And we have here the muscle tone, if it's flaccid, okay, it's 0. And for some flexion of the extremities, it's 1. And if it's well flexed, it's 2. For the reflex, okay, we have here grimace, it's 1. And 2 if the baby coughs or sneezes. And if there is no reaction when you slap the sole of the feet, it's 0. And 1 if there's a grimace. And if the baby cry or withdraws, it's 2. And the color, if it's acrocyanotic or acrocyanosis, ibig sabihin, the hands and the feet, okay, is bluish. Okay, and but it's 1, and then if it's completely pink, it's 2. So for the total, okay, 1 to 3, it means that the baby is in serious danger, and if the baby needs resuscitation, so you have to prepare the newborn kit where you could have your equipment for the CPR. So we do CPR, okay, if the nurse is trained, but the midwife could not do the CPR, okay, suctioning, okay, or giving medications as ordered by the doctor. But again, this is only the responsibility of the nurse, but the midwife could not give medication as to the scope of midwifery practice, okay? We have here, ayan, sorry for the delay. Okay, so we have here 4 to 6, the condition is guarded. The baby may need supplementary oxygen to clear the airways, and so we give the oxygen via face mask or cannula, or for 7 to 10, the condition is good. So when the condition is good, sometimes it's, and parang pinakamadami is 8, okay? So the baby will be given to the mother, okay, for latching on or for non-separation, okay, or skin-to-skin contact. For the vital signs, you have to check for the cardiac rate. Okay, you have to use the apical pulse. It is where dun sa may nipple line yan. Okay, so the heart rate of the baby is 160 to 180, but then again, it will become or stabilize at 120 to 160, wherein the normal FHT is also 120 to 160. If the radial pulse is not prominent, of course, it may be indicative of PDA or your patent doctor's arteriosus. Okay. Another one, you have respiratory rate. The respiratory rate could be rapid, irregular, shallow, and abdominal or diaphragmatic. So again, the respiratory system is medulla oblongata. Okay, but again, you have to be very careful of the assessment of the RR of the newborn. You could not do, you could not, for example, you will just be getting the RR of the patient for 15 minutes and times 4. That would not be okay for a newborn, because in newborn you have again transient tachypnea. Okay, so it stabilizes in 30 to 60 CPM or cardiac rate per minute. Okay, again, the newborn could have physiologic apnea of less than 15 seconds. Okay, but then again, if it's more than 15 seconds or less than 30, and then you have to um um refer it to the physician, because again, we don't want babies to be called as found dead. Sino yung mga found dead? Okay, these are newborns primarily, or most of the time they are newborns who are uh premature. Okay, and if they are not guarded, or if they are not um uh, watched over, or ibig sabihin hindi mo siya binabantayan, and then later on they will just be dead on in their bassinet. Okay, for the blood pressure, you might be surprised that the normal blood pressure is 75/42. Okay, so that's the normal blood or blood pressure of a baby. So these are the vital signs of the neonate. Watch out for, again, the difference of the blood pressure in upper and lower extremities. That's why you often see a newborn in the ICU. The BP is taken in the different extremities for us to rule out the coarctation of the aorta. So that's one way of ruling out the coarctation of the aorta. So what will you do upon the birth of the baby? Of course, number one is you have to take note of the maintenance of a neutral environment, because we have here the methods of heat loss. Okay, for convection, heat will be lost by cold air. So you, for example, the aircon, the OB/GYN would request you to put the aircon on a very low temperature. So that will not be possible for a baby who is born with the with the guide of the EINC protocol. Okay? For conduction, maybe we'll be touching the baby with cold hands, probably your gloves, and then you have evaporation. Okay, this one is done by TSB, or for example, if you're trying to remove the vernix caseosa. Okay, you should not be removing the vernix caseosa. Again, the vernix caseosa will protect the baby. Okay. Okay, guys, I'm sorry for that. Okay. For again, evaporation could happen when you're trying to remove the vernix caseosa. Again, vernix caseosa is for the protection of the baby against infection, and it is also essential in or for thermoregulation. Okay, and radiation, it could be indirect, or the bassinet is near the aircon. The bassinet is where you place the baby after the birth of the baby. Okay. For hypothermia, okay, again, you have to be very careful with the use of your thermometer, because sometimes you might notice that there is hypothermia, but then again, your thermometer is just low. But so we have to be very careful. Usually, for me, home, I have three thermometers to check the temperature of my baby. If should there be, for example, a fever or any condition that I might need to check the temperature, because sometimes again in newborns they could have hypothermia, or their temperature is less than 36.5. Okay, or what could be the reason of hypothermia, why this newborn are having hypothermia? Maybe the hypothalamus is not yet developed. Okay, or a flexed position. Okay, so when the baby is a flexed position, the fetal position, there is less exposure of the baby to the drop light. So if there is less exposure of the baby to the drop light, and then later on, okay, the baby could develop hypothermia, or the baby is very thin, or low birth weight, or small pre-gestational age, wherein the newborn have less subcutaneous or adipose tissues, or stored brown fats. These are, of course, necessary for heat production. For the methods of thermoregulation, of course, immediate and thorough drying. This is the first part of the essential intrapartum newborn care. You have to dry the newborn thoroughly for 30 seconds using a dry linen. In this one, okay, guys, you will have in the hospital, you will have two linens. Actually, the longer one for swaddling the baby, and the shorter is inside the longer one. And then the shorter linen, or the smaller linen, I'm sorry, the smaller linen will be used to wipe off the vernix caseosa in the eyes of the newborn, some secretions in the mouth and the eyes, and then the amniotic fluid in the body of the newborn. And then the bigger linen will be used for swaddling the baby. Okay, so what will you do? Do a quick check of breathing while drying. So you have to rub the back of the baby, and you try to observe the respirations. And of course, um, you have to have an organized sequence. You start from the mouth, the nose, rub the back, or cephalocaudal before the genitals. Of course, you don't want to spread the meconium. Should there be the meconium there? Okay, you don't want to spread the meconium to the mouth of the baby. It's always cephalocaudal, from the cleanest to dirtiest, and that is followed at all times. Wipe gently, do not wipe off vernix caseosa, because it has antibacterial properties. As what I'm telling you a while ago, is not only for antibacterial properties, but it is also an insulator. Okay, and then the smaller linen will be removed, and then it will be replaced with a bigger linen for swaddling. Okay, the drying one. So if the baby is not breathing, stimulate by drying the newborn. But then again, it should be observed, the color of the amniotic fluid should be observed. If the color of the amniotic fluid is gold or golden yellow, that might reflect RH incompatibility, then um, you should not stimulate crying, okay? Or if the amniotic fluid is meconium stained, you should not be stimulating the baby to what to cry. So what will you do first is to suction out, okay, suction out the meconium stained amniotic fluid, or the amniotic fluid, the gold amniotic fluid, okay, and then later on, okay, you would not do suctioning at that moment. You can only do suctioning. You could do suctioning for those cases, but you can only stimulate the baby to cry if the amniotic fluid is normal, or again it's clear or amber yellow because of the presence of the vernix caseosa. So Again, do not slap the baby, shake, okay? You only have to, maybe rubbing is allowed, okay? As evidence-based, rubbing is allowed, and you do the bagnet reflex, you place your two thumbs at the at the sole of the feet of the baby, okay? Do not ventilate unless the baby is floppy limp or not breathing. So do not give the baby oxygen, okay? Unless the baby needs it. And of course, do not suction unless the mouth or the nose are blocked with secretions. Again, the baby are nose breathers. So you, again, suction first, okay, the mouth. Next is the methods for regulation. I'm so sorry. Okay, so you have to delay bathing. So you have to delay it for 6 hours. And then again, later on, actually, the Vernix Casiosa will be like your dairy cream that when the baby is put on a drop light, it will just it will be fading or matutunaw siya. Okay. Why do we have to delay? Of course, it is for the prevention of infection. So you have to wear gloves to protect yourself and to protect the baby as well for um, diseases that are communicable by the bodily secretions. For the temperature, again, the room should be 24 degrees Celsius. Okay, you have to check on that. It's 24 to 28 degrees Celsius. And the water should be 36.5 to 37.3. Okay, these are two. Of course, these things are checked to protect the baby from having hypothermia. So you have to use the elbow to check the temperature of the water. Okay. You have to bath the baby before feeding the baby so that the baby will not vomit. Next is the manner of bathing. Okay, actually, this is discussed in your pediatrics, but then again, for the purposes of the week number of MCH and as per the ABPs and curriculum, we have to discuss it also in your OBA. From cleanest to dirtiest, areas of the body, the face, trunk, and extremities, and the diaper area, of course, again, cephalocaudal, from the cleanest to dirtiest. You have to wash the eyes, okay, but then again, you have to start from the inner to outer canthus and do not use soap. Okay. There are soap or cloth intended for the baby, so will not be um, destroying the skin of the baby. Okay, so you have to have football hold. Actually, ilalagay mo yung paa dun sa may kilikili. You will put the feet of the baby in your armpit and then hold the head of the baby so that, again, you will be holding the baby in one arm, and then when you are washing the baby, you should take note of the creases, okay? And then where the milk is accumulated to prevent rashes. And again, rashes is very difficult to uh, prevent and also to treat in babies. Okay, don't wet the cord again before the umbilical cord is washed. It is with alcohol or betadine, but now we are letting the umbilical cord to dry, okay, on its own to prevent infection. So the umbilical cord will need to heal on its own, okay? So you have to wipe the vulva from front to back. Again, you will have to, sometimes for a newborn, you will see what you call as, wait for me. I'll try to, we will see pseudo menstruation. Okay, pseudo menstruation is, parang you will see a speck of blood in the vagina of the newborn, and that is because of maternal hormones. Okay, it is because of maternal hormones. And what will you do with this one? You have to explain to the mother that this is normal and it will be it will be it will fade away. Okay, so it is because of maternal hormones. And of course, do not use powders or soaps for this one. Okay, next tayo. For the skin-to-skin contact, okay, after the delivery of the mother, you have to wrap the baby, and then again, before you place the mother or before you give the baby to the mother, do not give the erythromycin ophthalmic ointment, okay, so that the baby could have at least a vision of who is the mother, and that could promote bonding. That is and that is an EBP or an evidence-based practice. Okay, so you have to dry the newborn at once using a towel, and then wrap and cover the baby as mentioned a while ago, and then you have to place the baby in a radiant warmer or lamp, and then place the newborn on parents' arms. Okay, aside from that, aside from conserving heat or promoting bonding, if the body of the heat of the body of the mother, the heat of the body of the mother being transferred to the newborn could add to the weight of the newborn, and that is the rationale of kangaroo care. So kangaroo care, the bodily heat of the individual transferred from one individual may be adding to the weight of the baby. So kangaroo care is usually done to babies, preterm babies, okay, um uh, for uh, for increasing the weight of the baby. I'm sorry for that. Okay. So this one, how do you do the kangaroo care? Uh, it should be done by the mother. If the mother is not available, for example, if because of a complicated delivery, then the father could have the kangaroo care, or could do the kangaroo care, or anybody else. Okay, pwede naman yun eh. Basta the purpose is skin to skin contact. Okay, so how does it look like? Yeah, that is your kangaroo care. Okay, so kangaroo care is not for the promotion of bonding or thermoregulation, but solely the first purpose of the kangaroo care is to increase the weight of the baby. Secondarily, for thermoregulation and for bonding. Okay, so mamimili ka lang doon, and then we have here to establish or maintain respiration or patent airway. Do not suction the baby if the baby is crying, okay? Because you're just suctioning oxygen, okay? So suction should not be done for babies born through clear amniotic fluid, okay? You could just stimulate the baby to cry. So if the baby is not breathing or is gasping, or the RR is less than 30 or more than 60, and then of course, there must be something wrong with the baby, then you will have to have the valve aspirator. You have to suction the secretions of the baby. So what is the position? Put the baby on his side, okay, to drain the secretions, and then rub firmly the back of the baby. This is for draining the secretions and to prevent aspiration. Never hit the baby or hold the baby upside down to make him cry, because again, there is an evidence-based practice that when the baby is being hit, okay, and upside down, this they have proven that those babies who were hit before during the delivery became violent when they grew old. Okay, they became violent when they grew old. So watch out for vigorous suctioning, because aside from it could just if you suction vigorously, you could be destroying the mucous membrane, and then later on it leads to infection. So watch out for meconium stained babies. Okay, again, for meconium stained babies, which would mean that the meconium, the first stall of the baby, is now being uh, mixed to the amniotic fluid. You have to suction so that the amniotic fluid or the meconium stained amniotic fluid will not go to the lungs of the baby, so that the baby will not have what we call as meconium aspiration pneumonia, which would mean that the baby needs to be admitted if the baby will have meconium aspiration pneumonia. Okay, wait lang. Okay, so this is how you do the suctioning. You should be guiding your hands. Okay, so you should not be hitting the baby too hard, because again, the mucous membranes of the baby is sensitive. Okay, the adverse effects of suctioning, if you will not be doing it properly, of course, bradycardia, a slow heartbeat, apnea, or the baby will have absence of respiration, or vagal induced bradycardia. Okay, or slow rise in oxygen saturation. So it will be very difficult for you to have the normal oxygen saturation. And what I am telling you a while ago, it's the mucosal trauma that will possibly increase the risk of infection. Care of the eyes, or the prophylaxis, that's the grid's prophylaxis. Actually, this is done to prevent ophthalmia neonatorum, okay? The ophthalmia neonatorum, or uh, what we call as gonorrheal conjunctivitis. So what could be the causative agent? Neisseria gonorrhoeae from a mother with gonorrhea, chlamydia trachomatis. Okay, so what will you do? You will have to give your oxytetracycline ophthalmic ointment, or uh, your erythromycin ophthalmic ointment. Let me write that one. Okay, the new one is your erythromycin ophthalmic ointment. Okay. Erythromycin ophthalmic ointment. Again, was as what I told you a while ago, you should not be giving the erythromycin ophthalmic ointment before you give the baby to the mother. Again, that is for the purposes of bonding. Okay. at least may makikita na siya. So what will you do with the erythromycin ophthalmic ointment is you open the ointment and you have to start from the inner to outer contours of the eyes without even touching the eyelids, okay? So when you are able, for example, to place it like this, for example, you have to place it like this from the inner to outer contours, you should not be touching the eyelids. And then after you place the erythromycin ophthalmic ointment, you will just pinch the eye so that the medication will be spread through the eyes of the baby, okay? So that is your terramycin, your ophthalmic ointment. Okay? So that is how will you do it. Okay, next, you have here the care of the cord. Again, clamp the baby. Okay, again, we have to clamp the cord after the pulsation stops, and that is actually it's 1.5 inches. Okay, above the abdomen, and the califorceps are 5 inches off. But I think the updated one is 5 centimeters. Okay, it should be 5 centimeters. Okay, you have to correct this one. You place the first clamp. Okay, you place the first clamp or the umbilical clamp. Okay, umbilical clamp 2 cm away from the base. Okay, 2 cm away from the base, and then you place the califorceps about the califorceps. Okay, 3 cm away from the base. That will now give you the answer that you have to cut the cord 5 cm away from from the from the base. So okay, have to cut the cord 5 cm away from the base. How will you do that? How will you do that? Sorry for that one. If this is the umbilical cord, this is the base of the umbilical cord, you will be placing the first clamp 2 cm away from the base, and then you will be placing the next clamp here, the califorceps. Okay, that is 2 cm. This is 3 cm. Where will you cut the cord now? You will now cut the cord here. Okay, so that is cutting the cord 5 cm away from the base. That is what we mean by cutting the cord 5 cm away from the base. Okay, so again, you have to note for the AVA, the two arteries and one vein. So if there is missing vein or artery, then you have to uh, report it immediately because the patient might have congenital abnormalities that might need for follow-up checkup. So the cord should be dry until 7 to 10 days of life. It should fall off. And of course, you should not be putting anything to the umbilical cord. Okay, EINC guidelines for care of the cord, do not milk the cord. Okay, before kasi they are milking the cord towards the baby, okay? Because milking the cord could cause small blood vessels to the brain for rupture, okay, for possible rupture. And then is observed for oozing blood. Actually, the oozing blood, according to the doctor, it is an indication that the vitamin K is not enough. Okay, so you have to add more vitamin K to the baby. Actually, the baby will be given three days additional vitamin K. Okay, 0.5 vitamin K is given as per hospital protocol yun, ha. Okay, so dry the cord as recommended, and then you have to avoid the big kiss or barikes, okay, because that might be preventing the cord from drying, thus it leads to infection. So do not apply anything to the cord, like for example betadine, alcohol, or powders. Okay, let the cord dry on its own. And then you have here prevention of bleeding. You have to give vitamin K for coagulation or clotting. Okay, it is actually synthesized by the intestinal flora, but then again, um, vitamin K is very low at birth because of sterile intestines. Okay, so this is established through breastfeeding, but then again, the newborn is just born at that time, so wala pa siyang vitamin K. So again, vitamin K is given 0.1 ml to the vastus lateralis in hospitals. I am on the left vastus lateralis, and if the baby is preterm, it's 0.05. Okay, but that is again according to hospital protocol. That is again according to hospital protocol. So I have here vitamin K injection, so it's 0.1 ml of vitamin K. Okay. So route is left vastus lateralis. So this is for blood coagulation or clotting to prevent bleeding to the baby. Kasi once vitamin K is deficient to the baby, makikita mo from the cord there is an oozing blood. Okay, and that according to the doctor, if that is not prevented, it could lead to CNS hemorrhage later on. Okay, so that's your vitamin K. This is your vastus lateralis, where you will be injecting the vitamin K through in the intramuscular route. Okay, so that is how you do the vitamin K injection. So do not be afraid. You have to have somebody else to hold the baby before injecting the vitamin K. Prevention of infection for immunization. Of course, you have to with the congruence to the PD 996 Presidential Decree 996 or the expanded program on immunization. All children below 8 years old should be fully immunized. So for the BCG, okay, in the hospital, you might need to wait for 10 newborns para maghati-hati from one BCG. Okay, so but then again, BCG is given 0.05, okay, intradermal in the right deltoid. Before, we have BCG skull entrance and BCG at birth, but it is updated now that we only have one dose of BCG, and that is given at birth of the baby. Okay, intradermal in the right deltoid. Okay. It prevents PTB or pulmonary tuberculosis or TB meningitis and leprosy. Okay, normal reactions. You will have fever, you will have keloid, and you will have NANA. Okay, that is normal reaction. Okay, if the mother has PTB and is under treatment for 2 months, defer BCG. So the antibodies will be received by the baby via breastfeeding. Hepa B, of course, it should be given. Okay. In the right vastus lateralis, IM din siya. So si BC, vitamin K, left vastus lateralis, si hepatitis B, right vastus lateralis. But again, it's 0.5 ml on the part of the outer thigh. Again, vitamin K is left vastus lateralis, IM. Hepa B is right vastus lateralis, 0.5 m. Okay. For the vitamin K, it's 0.1. For preterm, it's 0.05. So you have your BCG vaccine, okay, ida-dilute mo siya dito, okay, diluent yung isa, okay. For the hepatitis B vaccine, this is how it looks like. Okay, so for this one, it's the deltoid of the baby. You will be injecting the BCG here, and it's intradermal. You should at least form a will for you to be able to be sure that you are injecting the vaccine doon sa right route, okay. Next is newborn identification. So how would you identify your newborn? Again, aside from the sex and the time of the baby that you have mentioned after the delivery of the baby, then you have to have the two bands. But the footprints are not used now. Okay, so i-update lang natin that the footprints are no longer used in hospitals, but you have to place the bands at the feet of the baby. Bakit sa feet ng baby para hindi matanggal. So it will not be removed. So actually, when the baby is a boy or a male, we are giving a blue band, and pag yan naman ay female, we give a pink band. Okay. Next is birth registration, of course, for incongruence or with the directive of PD 651. That's the birth registration code. The midwife or nurse who attended the delivery should register the baby within 30 days after delivery. So you will be observing in the different hospitals that babies who will be born with this is we observe that the midwife will have the draft for the civil registry to get the information of the baby and the mother for registration. Okay, so these are very important in providing eligibility for school voting passports and etc. So it will contain the infant's name, the mother and father's name, birth date, and birthplace must be recorded. For example, the mother will not or doesn't want to tell you the name of the father, and then the baby will be illegitimate, and that is again the right of the mother. Okay, right niya yun. So you will not have to question that one. So this is an example of the certificate of live birth. Okay, that is uh, um, in the midwife's hands. So siya talaga yung nagkukuha nito. Anthropometric measurement, of course, you have to ascertain that the body proportions of that the body proportions and condition of the baby. Kasi if these are not appropriate with the normal measurements, and then later on we will be considering some condition of the baby. So we have here the length of the baby should be 45 to 55. Okay, but it depends if the baby will have other genes. Okay, head circumference is 33 to 35 centimeters for us to know if the baby is having microcephaly, anencephaly, or hydrocephalus. Okay, the chest circumference is 30 to 33 centimeters. The abdominal circumference is 29 to 33 centimeters. and the weight of the baby should be 2.5 to 4.0 kilograms for us to note if the baby's SGA is small for gestational age or large for gestational age. So this is how we do the measuring of the babies. For the head circumference, dito sa frontal prominence, for the for example, the chest circumference, it should be on the nipple line. I'm sorry, because you cannot see my nipple. I'm sorry. Okay, on the nipple line, and then the abdominal circumference should be along the umbilicus, but not with umbilical cord. Okay, so the weight of the baby will be in kilograms, or sometimes it's in pounds. So this is how you do it. Okay. Next. We have here the physiologic weight loss. During the first 5 days of life, you would notice that there is physiologic weight loss of the baby. So what could be the reason of physiologic weight loss? Because of course the baby is no longer within the mother, the maternal hormones, okay, for sodium and water retention. And of course, yeah, nabubuoyed na sila, and then they pass the stools and the low calorie intake because of the colostrum. The colostrum is the first milk of the mother, and this is rich in antibodies. It should not be uh, drink by the father. So these are the reasons why the baby will have the physiologic. It's a normal weight loss. Okay. Okay. So that's the colostrum. The colostrum, if you would try to see, the colostrum is just light yellow, and then later on it will become white. Okay. So this is breastfeeding. It will be discussed by your pediatric professor. Thank you so much for the night. We'll have the next lessons the other day.